Are you at the point that you think you may be struggling with disordered eating, yet you don't really know what to do? Hi, welcome back to my channel. My name is Stephanie. I'm a therapist in New York that specializes in eating disorders and treatment of body image issues. And today I wanted to talk about what the next steps are once you realize that you may be having a problem. And if you recall, about 10 seconds ago, I just mentioned disordered eating, and that might be a new flip on the original term that you normally hear, which is eating disorder. So disordered eating might be not necessarily an eating disorder, but something is disordered about your eating. So whether that means that you're not eating what you need to be doing, what you need to be eating because of whatever your thoughts are in your mind, whatever the case might be, your eating patterns are not what they should be or what would be considered normal. So let's talk about whether or not you're struggling with disordered eating, an eating disorder, body image issues, or any of that stuff. You don't need to meet certain criteria to get help. If you are struggling at all, and my criteria, if anyone asks me what it takes to see me as a therapist, I say if you're struggling at all, that qualifies you to see me. So I would suggest right off the bat, if you're struggling at all with any type of those things, get a therapist, and they can help you to, one, improve your relationship with food, and two, to hopefully steer you from getting worse in your eating disorder or maybe developing into an eating disorder, and be able to get you the correct help that you need. Now, one big tip that I hope that you take away from this, and this is really what the video is about, is making sure that you find a therapist that specializes in eating disorders. So how do you know that? How do you know whether or not a therapist specializes in eating disorders? Do your research and really research well. I can guarantee you that many therapists do say that they work with eating disorders, and that normally isn't the case, and it's no fault of their own, but it is actually a highly specialized. Oh gosh. Okay, as I was saying, eating disorders are a very specialized disorder to really be working with, and there needs to be a lot of sensitivity that therapists that are trained in I don't want to say regular therapy, but that aren't trained in necessarily eating disorders may not be astute to the fact that it requires a high level of sensitivity in very specific parts of treatment of eating disorders. So do your research, and how then, getting back to that question, how do you do that? I would look up online, of course, that's usually what people end up doing, and look up a couple ones that you think maybe you click with, or if there's insurance, if you're looking to get coverage from insurance, look for therapists that might be covered for your insurance, look for what they do talk about in their biography or whatever they do have on the website that you're looking up on. So look on that, but then I would go further and contact that therapist either by email or by phone and ask questions. Ask what their history of treating eating disorders are. Ask what their knowledge base, what their comfort level is to treat that type of disorder. And you'll probably get a pretty good idea as to whether or not they really are a specialized a psychotherapist, or maybe it's just kind of like the check all boxes, and that eating disorders just happens to be one of the boxes that in the disorder column that people say they treat. So just do your research. Now, it's really important to get together your particular treatment team. So when you are working with a therapist, they're also going to recommend, if you're struggling with eating issues, a nutritionist. And also, extremely, incredibly important to find one that specializes in the treatment of eating disorders, and one that is very directive toward that population, because unfortunately there's a lot of people, a lot of nutritionists out there, and they work with other things more along the lines of, weight loss or something along those lines, and that can be incredibly detrimental for someone struggling with an eating disorder or eating issues. So make sure that you're getting a therapist that specializes in eating disorders. Make sure that you're getting a nutritionist that specializes in eating disorders. More often than not, if you or the therapist should be the first stop, and they will have recommendations for you with people that they work with that also specialize in the treatment of eating disorders. So it's not like high and dry, because sometimes it is very difficult to put together that team. So just shop around, look for therapists that you feel like you click with, and then also work with that population, with the eating disorder population, and just get to know them a little bit more. Most therapists will offer consultations for free, whether that be by phone or in person. I offer free consultations in person, and if for any reason it is a video client in the future, and we can't really, let's say if you're upstate New York and you can't get into my office, I do it via video or phone. And that's really just to get to know each other and really feel if it's a good fit, really make sure that the recommendation for treatment is outpatient care or if there's a higher level of care needed at that point. Just really evaluating to see if that's a good fit and that level of care is a good fit. So that's what a consultation will be helpful for, and most, like I said, most therapists will offer that. And if they don't, then you might have to go to the next one and get a little bit more information if they're not giving you what you need. So, highly important, take from this video, get a therapist that specializes in eating disorders, get a nutritionist that specializes in eating disorders, and get help as soon as possible. Research shows, and a lot of research shows this, and you can look it up on your own, that the earlier an eating disorder is caught and treated, the shorter the prognosis, and the quicker usually you're able to get into recovery. And that means less treatment, which means a hell of a lot less money, because treatment is very expensive, less time out of your life for needing to treat this disorder before it gets worse. So I hope that you took something from this video. If you're interested in learning more, I have a blog, and I'll leave that in the description below, and that's other things that, pertaining to eating disorders, and I hope that that's helpful for you as well. I would love for you to comment your thoughts on this video and what your thoughts are just on the whole treatment protocol. If there's any questions that you have as to what may be your next step, if you're feeling like you're struggling, leave them in the comments below. And if you like these types of videos, if they're informative, if they're helpful for you, I would really, really appreciate if you subscribe to my channel and like this video. So until next time, have a great day, and I'll see you in my next video. Bye!